Welcome back to Plastic Surgery Untold, greatest podcast in the world, is voted by us. Today we're going to talk a little bit about cellulite and some of the new exciting treatments out there. We have a special guest from our home state, Texas, Dr. Kristi Hustack, who's going to talk to us about this. But tell us a little bit about your practice, and we've met each other on a few panels talking about cellulite, so super excited for you to take time out of your busy schedule, because I know you got 1,000 talks going on this weekend, so thanks for taking a few minutes to join us.
Oh, you're so kind. It's so great to be here and visit with you a little bit about something we're both passionate about, which is great. So, I'm right down the road from you in Houston, Texas. Cellulite is not exclusive to any location, right? Or any demographic. 90% of us have issues with it, and there's an unmet need. So it's awesome. I do a lot of, I was originally the only female in my group of 7 males, and we flexed now and took our second female, our fellow Abby Rodriguez. She's fantastic. But this was a natural segue for me, right? Lots of women don't talk about their cellulite because it's almost like a shameful thing, like, oh, you're not working out hard enough, you're not dieting enough. And we know that's not simply true. So it was kind of nice, as I'm talking about my mommy makeovers and we're doing an exam, they're like, well, what do I do for this cellulite? And so it's been a nice little easy segue, and it's certainly something that I don't, bring up. Nobody wants to be like, ooh, you want me to do something about your dimples, which I don't call cellulite, I call them dimples. I think that's a little less, scary to talk about. And so it's been kind of a nice little segue to finally have something to offer that I think is precise and verifiable and I know works, and I've had universal happiness so far since we started rolling it out.
And don't you think that's been the biggest pushback and maybe even the most hesitation from us, is that, it's not a new problem, but something that there just weren't a lot of great solutions. Sure. Most people have bought stuff either on infomercials, tried different things, have just wasted a lot of time, effort, and money on stuff that just really made no long-term benefit. And I think that's what's been a big change, is some of the new devices that are out there to treat this. Absolutely.
I mean, I think most of us have bought like every cream on the market to rub it, in your closet. You're waking up in the morning and you're just like, it's still nothing, and especially as we age, you get that combo dimples, you get your really deep genetic ones you've had since you were, 17 years old, even when you were super thin and athletic, and it just, the process continues with some skin stuff. So I've actually been having fun doing it as combo procedures. So I do a lot of fat transfers to the buttocks. So my BBLs, I'm doing it single stages. I know you and I have chatted a bit about some of that and how we make that work or not, because it is kind of a newer thing. And then a lot of energy-based devices for skin tightening as well. So I'm really liking those composites for my gals that are, athletic tennis players, but they've got that, those couple areas, those couple dimples that drive them nuts, but skin laxity as well. And, you can do some of those combo treatments so you get lower body rejuvenation in total, right? So you get around your knees, and you get your inner thighs and your outer thighs, and it's been a great adjunct.
You touched on a couple things that are super dear and close to my heart. One, because you do a lot of fat transfer and BBLs, but don't you, and we had a segment earlier about the kind of the evolution of BBLs, because somebody had said to me a couple weeks ago, what are you going to do now that people don't want fat transfer? And I just think that that's not true. I think it's a different, and Sarah and Jenna, our extenders, have helped treat a lot of this, because it's not that they don't want it, but I think what people are requesting, we get a lot more requests for this athletic, kind of tight butt things. And this is where you've already alluded to this kind of total body rejuvenation in terms of treating the multiple components, the skin laxity, the dimples, and then addressing the volume needs. And then I think with the weight loss revolution, there's going to be even more of this complex nature. And maybe you can touch a little bit about if you've seen some of those trends in Texas, and then maybe we'll get Sarah and Jenna to jump in about how we've done it. Because even if people have had BBLs in the past, doesn't mean that they can't still treat their dimples now.
And that's actually some of my happiest patients, my old BBLs that just need that extra little, little bit of rounding for those couple dimples, because they're showing it off, right? So this is just the last, piece of the puzzle. But yeah, no, I think women get scared because when they come in, I always offer, when I'm doing liposuction, do you want me to put that fat anywhere? Do you want me to put it in your booty, the back of your hands, your face, your breasts, or do you want me to throw it in the trash? And, I think in the beginning, lots of people are like, wait, I can put that somewhere? And so they would get really nervous. I'm like, I'm not, I'll give you a Nicki Minaj if you want, but that's usually not my aesthetic. Most of my aesthetic is a little bit more simple, natural, and maybe just a little bit of rounding, a little bit of hip dips, something to keep their jeans up, nothing. And I tell people, it can look really natural. Like, this is just a volume, restoration. We don't have to over augment. We can just kind of give you back that little bit of projection that would round out the rest of your frame. So I think when you say it like that and show them pictures, they're like, oh, thank God. So not everybody's gonna be like, oh, you had a BBL, and as you run, your booty runs separate from your body, and like, so I think it's been great.
But with and especially with the weight loss revolution, and people who haven't followed, I'm down about 70 pounds. I think
you're looking good.
I've probably lost 40 pounds since I last saw you at the Texas Society. And so, but unfortunately, it's great for the visceral fat for some of these, but we tend to lose it in places that maybe we don't.
Sure.
Face and butt tends to be one. And so we've started to get a lot of requests from people who they're not trying to look for something huge. They just want to restore the volume. They love the way their tummy looks. They just want to restore what they lost in their butt, make sure their pants don't fall down.
Absolutely. Yep. They just want that little bit of balance. And I think that's a great thing to do at the same time.
How do you do it in your practice? Because we talked a little bit about this on a panel we were at a couple months ago in terms of doing it at the same time, pre-treating. Love for you and Sarah to talk about. Do you have extenders that do this? Do you do the cellulite treatment on here? Because Aveli, one of the new devices, has really made this much more reproducible and easy, because I think in the past there were some mechanical ways to do this, but very technical dependent, hard to delegate, hard to be reproducible and verify.
Yeah, no, definitely. If it's a standalone procedure, something that can easily be done under local, my extenders are doing it. Absolutely. And some of my old BBLs, for example, they don't need me, right? And so those are great ones for my extenders to do. And those are the home runs. I am doing, obviously, the ones that are done in the OR. And we're still dabbling with these composite devices. So doing different things, different modalities at the same time. So as we're still kind of rolling that out, or it's bigger procedures, I am doing those myself in the operating room. But when they're standalones or previous BBL patients, or maybe combining those even with some radiofrequency subdermal or transcutaneous, then I'm having my extenders do it, and they're doing fantastic.
And something I want to, we were talking about the other night, I'm super excited. Offline, I want to talk to you a little bit about it, because we've started, we've been using the ultrasound, and I think the buttock anatomy is so much more complex than people ever imagined, and BBLs are relatively new, but when you separate out those spaces, we've had really, really good success of treating the cellulite, treating the deep fat, not muscle, in terms of filling that space, and then still being able to have that nice skin. You don't get the skin issues. You don't get any of the little bleb stuff, because people are looking for a nice, perky, smooth butt stuff, which has been super neat that we can see this anatomy so clearly.
Well, I think this is a perfect example of, innovation spurring research versus the other way around, right? Once we started saying, hey, how can we make this safer? How can we make this better? We threw an ultrasound. And then we're like, wow, that really took us back to anatomy labs, and we're learning much more about the topography of the buttocks and the different fat compartments. And I know Pasmino and others have done really good work on that. And I think that's changed the way I do BBLs. I can lose less volume, and especially with Aveli, I'm in a totally different plane for these releases. So I'm not having issues having to make separate incisions. I'm not having fat egress, especially when you're doing your skinny BBLs. You don't have a lot of fat, right?
No.
You don't want to lose that liquid gold. And so it's really nice, because you put it in, it projects beautifully, and then you're in a more superficial plane doing these releases. So it's actually been a game changer, the way we're doing these new age BBLs, and they're being safer and they look better. Great, win-win.
And Sarah, talk to us a little bit, because it used to be that sort of like Kristi's talking about, where we did BBLs and then came back and, here's some cellulite. But the paradigm shifted a little bit in our practice, where we have people coming in because the cellulite's the bigger issue than the volume. And then, they tend to come to be ours. And I know you made a big deal, because you have your own fly-in patients to get cellulite treatment, which, she wants to get her own board with a different color pins. We have a map on our board, but that's still under negotiation.
I never said that, just for the record. This has been a great addition to our practice. I know in our office, we recommend pre-treating if you're doing a BBL, if we're doing this before surgery. If we recommended it and you decided not to do it, or maybe if you are one of our past patients and so this wasn't something we could offer, then we obviously will do it post-BBL, which we've talked about. Those patients are super happy. They look great. But just like Dr. Franco alluded to, we also are having patients come in specifically for the Aveli. And it works so great, because it's a one-time procedure. We can do it in office or in surgery, like you said. And they've been super happy with the results. It's precise, it's verifiable, and it's just reliable.
And Kristi mentioned to a cool point that we probably started only about 6-9 months ago, and sounds like you were ahead of us in terms of this for sure. But combining cellulite treatment with some RF microneedling or different energy devices, because of that skin issue, which is going to become even more of an issue over the next,
especially with the weight loss. Absolutely, yep.
Yeah, the multimodal treatments, and I feel like I agree with you. We weren't quite, on top of this in the beginning, but lately we're really trying to come up with, it may be a year-long treatment plan for our patients, but to really get them where they want to be, because I feel like very few patients really just need to treat the cellulite, right? So that's great. And if you're them, then that's great. But most of them, they come in and we're going to tell them, the Aveli is going to be perfect for your true dimples. Like you said, we'll call them dimples, because we know they're caused by those fibrous bands. I think that's what really hits home with the patients, is like, it doesn't matter if you work out like crazy or you're super thin, it's not going to take care of the dimples. We'll release those. And then probably got a little bit of skin laxity going on, so combining that with some energy. And then if they're not a surgical candidate or they don't want to do surgery, we're looking at adding volume other ways with maybe some fillers, some hyperdilute. So yeah, I'm loving the combination treatments, and the patients are loving it too.
Because don't you guys think, as being dimple experts, a lot of times when you get referrals for people that were unsuccessful with cellulite, and especially if they use something like an Aveli things, a lot of them were mistreated and mistaken for skin laxity, and it wasn't treating the right problem to begin with, and that's why the treatment didn't work. And so I think just super interesting in terms of those things. Jenna, talk to us a little bit when you've done procedures under local and don't get the benefit of doing general anesthesia like Kristi and I. How do patients tolerated this? Because it's definitely super intriguing to be able to come in, get a treatment, go home the same day, and be back to work.
It is, for sure. And that's what's so nice is, it's like education, right? Letting them know exactly what to expect so they have a realistic expectation of what it's going to be like. But we really take our time with the tumescing, and we have Pronox too, which is super nice to offer to our patients. But I think taking your time is the key to making sure they're comfortable, and then just checking in, and they really appreciate that for sure.
They've done great. Yeah, for the most part, they're super, super comfortable. We've gotten really good feedback, and they love being able to do it awake, come in, fly out, drive in, drive out. Super easy, one-time treatment you can do in about an hour.
Yeah, and recovery, has been pretty simple for most of our patients. It's not too severe, for sure.
And what do you think, Kristi, in terms of this? Because we had Dr. Nykiel on previously, and one of the things that we were talking about when you combine, treating cellulite with BBLs, and love to get your thoughts because you do so many of these, is I feel like there is some shape changing that you can create when you release those bands. Because to your point, one, if you're just trying to overfill this, and it's like the old concept with breast that we're going to fix a lift and other issues by just putting this massive implant in, which we just caused more problems than really treating the same issue. Don't you think there's some degree of that we're just scratching the surface of like treating cellulite, treating some of these structures rather than just pumping a bunch of fat into the butt?
Absolutely. I think where you really see that, and where I've been playing a lot with it, is that the inferior medial aspect of the buttocks. And some women, they just have a really tight band there. And we've learned over the years that you don't put fat there because it almost herniates, and you get, that kind of diaper butt, as colloquially we talked about. And so it's not a good look, right? It's a very squared shape. So, I've been playing with this device to release those fiber strands. They're not dimples like we classically teach about, but the same device can release that. And it's really rounding out that shape. And I think that's been a really nice thing, to your point about shaping. And you can really, infralateral bands to really shape, you can do a lot with this device and use it, in off-label ways to kind of help reshape. And I think that's been great too.
Because I remember you talking a little bit about that at the Texas Society. And this is where I think that the whole BBL paradigm is changing, right? Because it's not this massive butt. They want this athletic look. We talk about athletic on the front, athletic on the back. And, people don't know whether they live in that plastic surgery life or that squat life, and that's cool. We'll keep it our secret. And the other, 1 million people that are listening to us. But other than that, it's cool. It's our little secret. What other trends do you think in terms of cellulite, fat transfer stuff do you see kind of coming up in the future? Because I don't think it's going away. I think it's just changing in terms of what people are asking for.
No, absolutely. And I think social media really drives a lot of this innovation too, which is great because, the bad thing about cellulite is it's, again, the equalizer. Every race, ethnicity has this problem, and every age spectrum, right? So you got your young, 18 to 20-year-old demographic, young, athletic, beautiful, that have those couple dimples. But you're also getting your 50, 60, 70-year-olds too, right? So I think this is nice because as we start dabbling a little bit, we're really seeing that full spectrum. And I think that's been a nice thing too, to keep all those patients in your practice from the very beginning to the very end, because there's different things at different requests at different ages, including those postmenopausal ages for sure.
Kristi, we won't keep you too much. I know you got another big panel to do here in about 30 minutes, so appreciate you squeezing us in. Tell us one more time for all the listeners, your Instagram handle and the name of your practice, so all of our listeners can see you if they're in Houston, because I know there's a lot of needs for this in Houston as well.
Yeah, no, definitely. So I keep it simple, right? It's just my first name, last name. So Kristi Hustack, MD. That's my Instagram. That's my website. I'm not very inventive. It's easy. So yeah, you can find me via my name. Absolutely. And I'm in Houston, Texas, group private practice, aesthetic center for plastic surgery, and you can find us there as well.
Awesome. I appreciate you taking time. Plastic Surgery Untold, greatest podcast in the world. Thanks for educating us about Aveli and cellulite. So
awesome.
Thank you.
Thanks so much for having me.
We'll see you. Bye.